And that was Beatrice, our diamond sponsor. Our next speaker is Adjunct Assistant Professor Jason Chia, Senior Consultant and Head of the Sports Medicine and Surgery Clinic at Tock Seng Hospital. He is a member of the Singapore National Olympic Committee Medical Committee and chairs the Ethics Review Board of the Singapore Sport Institute. His current interest is in dance and dance medicine and has trained at the Harkness Centre for Dance Injuries. He also serves on the board of the John Neate Dance Company and PHE Dance Company. His talk today will discuss the perspective of dancers as artistic athletes. Dr. Chia, please.
Hi, Prin, thank you very much. Can I just check if the visuals and sound is coming across?
Yep, they're coming across nicely.
Okay, I'm just going to share my slide now and let's see whether that works. How is that? How's that?
Yeah, looks good. Looks good now. Yeah.
You can see the first slide, right? Okay,
yep.
Sorry, I just ran into trouble with this thing again. Let me just shrink this and do this one more time. How's that? Is that okay?
Yes, it looks fine.
Okay, good. Let's begin then. Thank you very much. First of all, let me start off with thanks. Thanks to the committee for inviting me over to speak on something that is quite close to my heart. I've been having an interest in dance medicine since, I think, 2013, if memory serves me. And I think it's a good opportunity to spend the Saturday morning talking to people who are interested in this. When I was first asked to speak on managing dance injuries, it gave me a bit of time to go and take a step back and ask myself, what in the world is dance? And the usual thing I did was just to go to the dictionary and have a look at it. So what is the definition of dance? And as you can see here, it is what does it say here? The movement of the body in a rhythmic manner, usually to music, within a given space. And I think the key words is expressing an idea or emotion, releasing energy. That's one aspect of it. And then the other aspect is, of course, people dance because they delight in the movement. Having said that, if you look at this definition, it is truly broad. And my reflection on that was that, wow, that's a lot to cover, even if you focus on the injuries in 25 minutes. And I started to ask myself, rather than trying to go through every region in the body that dancer might suffer from some dance affliction, right? Maybe I could just speak on the things I've learned looking after local dancers for the past 8 years, 7, 8 years. So in other words, I'm going to indulge in a bit of cherry picking. The second thing is really that of a disclaimer. I don't pretend to be an artist. I'm primarily trained as a clinician. So most of the things I'll be talking about are really from a clinician's perspective. At most, I dabble in dance, and if I'm lucky and the community in dance counts me as one of them, I at most straddle these two worlds of medicine and dance, which I found to be quite different when I started trying to learn dance. But nevertheless, I found that as a clinician, it's quite impossible to manage dancers and their injuries comprehensively without knowing the background and the social aspects of dancers and the dance community in general. So that's the second thing I want to talk about. The third thing is really setting up a frame of, I would say the frame of reference, how to understand dance injuries. And really, I am just comparing and contrasting. At what point are dancers similar to the athletes, which we are more familiar in treating? And in a sense, how different are they? And these different things might actually highlight them as a group of athletes that requires special attention. So that's the way to understand perhaps the rest of the talk. Now you can see from this picture that their similarities are very obvious. It is the amount of control and strength and flexibility to achieve this poise seems very similar, especially if you compare sports with an artistic component to dancers. And indeed, there are, to a certain extent, athletes and dancers spend a lot of time practicing their technique. And the repetitive motions that they subject their bodies to, of course, can result in injuries, or sometimes even accidents happening during the course of their practice. So in that way, you can think of, well, a knee pain is a knee pain, whether it's an athlete or dancer, and an ankle sprain is an ankle sprain. But nevertheless, I would like to propose that there are some differences. And what are these differences? I think first and foremost, although we, as a clinician, we might think of anatomically that dancers are actually artistic athletes, right? But I think the operative words that they started off, at least their intention is to be artists. It so happens that the instrument that they use on a daily basis to express their art is actually their body. That's the amount of overlap. And as you can see from the picture on the bottom left, right, the ways that they move are mainly to evoke motion and sometimes convey momentum, etc., etc. It is quite unlike an athlete in the sense that very often there isn't a single matrix that an athlete might focus on, whether he goes faster or stronger or higher or whatever. And the end result of this difference in starting point is that the end point is different, and therefore the amount of the range of movements that they have to subject their body to is not very stereotypical. In fact, if my slides convey the message across, it's very, very varied. And this is not taking into account the fact that the choreographic demands when they perform, right, might actually involve novel movements, which are sometimes very different from what they've been practicing. So we have to keep that in mind when we are studying dancers' injuries to understand that this variance happens. Now, of course, there are other reasons that come about from this difference in endpoint. Dancers, of course, constitutionally are different. At least in the professional circles, there's a higher incidence of hypermobility. They're different in the way they move, in terms of vocabulary movement and the way they talk and they learn movement. And the training practices and traditions are different because they really aren't athletes to begin with. Yeah. There are certain social reasons in which they might be behaving differently when they are in a consultation room. And of course, there's this question of this the psychology of a performing artist, which I'll touch on briefly. So if you look at dance, right, or rather the picture on the left, it is quite obvious that there are many, many genres in the dance. Going back to looking at an athlete, for example, if I wanted to solve a problem of a recurring injury, right, I often do a bit of biomechanical analysis. And one of those things I do quite often in my clinic when it comes to looking after runners is to do something called visual gait analysis, video gait analysis, apologies. And as a movement pattern running itself, it lends itself to that kind of analysis. But if you start looking at dance and there are multiple genres, right, then it is actually quite difficult to apply that kind of approach. But nevertheless, it is important to try to look at the fundamental movements in each genre and try to understand them and how repetitions or technical errors in the repetition might actually result in injuries. So for example, we know that certain genres have certain anatomical variations in terms of the injury rates. In tap dance and in ballet, the foot and ankle is high on the list. Sometimes it's just purely in terms of the repetition. Sometimes it's what you need to do with the feet themselves. Like extending at the tips of the toes is very physically demanding. And of course, if you look at certain forms of street dance, like break dancing, it is quite obvious why the neck injuries might be higher. And contemporary dance actually has a lot of variation. But if you compare to a more stereotypical or more traditional art form like ballet, for example, comparatively, they might have a higher incidence of wrong knee, and to a certain extent, back pain as well. Now, sometimes this injury happens as a result of the aesthetic demands. It's just intrinsic to the art form, and we have to respect that. For example, in ballet, this constant pursuit of the turnout, right, might result in compensatory movement patterns that predispose the dancer to that kind of injury. And we have to be able to understand why the dancers do that and study their body so that we understand at what point are they doing it correctly, at what point are they cheating in order to achieve this aesthetics. If you take into account the fact that, and this is actually drawn from a local study, a survey study looking at dance practices in dances in Singapore, actually, complicated as it is to just to study one genre, a lot of dancers actually dance in multiple genres. So it becomes very complex, especially if they're doing it for many years, and this constant practice shapes their bodies quite literally. They adopt certain practices, certain compensatory movement patterns, they develop tightness in certain areas. They might even collect injuries over the years of dancing. And if they are doing it in multiple genres, then they actually overlap to a large extent. This is actually another factoid that comes from that local dance study. And at the point in time when we did the survey, quite a lot of dancers have recurrent injuries. Now, why they have recurrent injuries vary, but one of those things as a result of this piece of information is to try to really to look at the technicalities of a dancer. Because if the technique is not actually correct, then they expose themselves to the same biomechanical factors, and then that might account for the recurrent injuries. Technical errors aside, right, we know for a long time that the practice of dance itself, certain practices actually create different forms of injury. This is one in a series of studies that was published by Asst more than a decade ago, describing how the pattern of hamstring injuries differ between athletes and dancers. In summary, athletes sometimes get their hamstring injuries in the belly of the muscle from eccentric movement, from explosive movements like sprinting. Whereas dancers encounter this problem from slow stretching movements, trying to achieve the flexibility that they so desire. And the result of that is that the anatomical region of the hamstring that is mostly injured is in the tendinous junction. And of course, if you look at the graph on the left, that actually changes the prognosis of the problem. The healing time is very much slower, almost twice as slow. The other thing to note is, and I think Leonard has alluded to that dancers actually are constitutionally different. The hamstring flexibility is very, very variable. So if you were to look after a hamstring injury and monitor them over time, right, what is your normal is they are very abnormal. Right? It is imperative if you have a normal site to compare against that if you were to look at hamstring flexibility. In a similar vein, and this is a slight tangent, if we were doing a straight leg raise on a dancer to look for some sort of nerve root impingement, right, you have to compare to the opposite side. Very often, when we do it to 90 and it doesn't reproduce the symptoms, we might say that is normal. But if you push it a bit further, the symptoms might actually come about. So the practice of dance changes the injuries. It changes the way you need to assess the patient. The other aspect of dance, which is quite prevalent, is this focus on doing splits and thin flexibility. And there are actually quite a few studies that show that this common accepted practice amongst dancers, right, in order to achieve that kind of split, actually results in subluxation, partial subluxation to the hips. And the study shows that it actually increases contact pressure at parts of the cartilage and the labrum as well. And repeated over a lifetime might introduce micro instability in the hip. Now, we don't have conclusive proof as to what is the long-term outcome of this kind of practice, but suffice it to say that in some of the studies, it shows that one of the two causes that causes professional dancers to retire besides back pain is actually that of hip pain. And one wonders whether this kind of repeated and small insults to the hip joints result in earlier wear and tear. Now, but it's not all gloom and doom. Dance practice are not always detrimental. And we know from demographic studies that actually female dancers, compared to their male counterparts, don't have that propensity, this inequality in terms of the rates of non-contact ACL. And if you have, for example, done a bit of ballet training, right, you will realize that the way dance approach jumping and landing is very different. Of course, they did it from the aesthetic point of view, asking dancers to push off using ankle plantar flexion and using their toe flexors as well. And then, of course, to land eccentrically on that, as you can see on the picture on the left. It is aesthetically more appealing, but strangely enough, when the biomechanics look at the landing and jumping pattern, right, in trained female dancers, right, the landing pattern has got the better control of external turnout and less vulgar stress. So it might be a happy situation where the aesthetic demands actually results in better landing mechanics. And it is probably not because dancers as a group are that special, because somebody has actually done a further study that shows that if fatigue dancers, right, female dancers with repeated landing and jumping and landing, the landing patterns approaches the kind that will actually predispose them to ACL injury. So we can probably ascribe that to some of the beneficial effects of dance training. Now, how does dance and the aesthetics of dance changes the way you manage, for example, a common injury like ankle sprain? To us, when we look at an athlete, we find that if you have a full range of movement and strength, we might consider that, okay, okay, really balance on single leg seems to be okay between the right and left. And that's the end of the story. But the problem is that when we have an initial diagnosis of an ankle sprain, right, what does it mean to a dancer? What does it mean in terms of her ballet practice, for example? Does it mean that she can't releve, can't undo? When she progresses back to her training gradually, right? How do we communicate that to the dancer themselves in a way that is reflective of her practice? So, for example, in this particular case that we saw in a young dancer that had an ankle injury, when we tried to get her back to on-point training, she developed postural ankle pain, and radiologically it looks fine. There was no os trigonum, for example. Sorry, I have a raised hand with Adeline Wong. I think I'll continue for now. And we had to solve that by actually increasing the mid-foot flexibility. And of course, she was able to go back initially. And later on, she tells us that she has postural ankle pain when she does a lot of on-point work. And then again, we assess her core strength, and we realize that she has lost some of the core strength on the affected side during the rehab process, and we had to address that before she could go back to point training. The other thing that I think is a challenge when treating dancers instead of communication, it is known actually from quite a few international studies that doctors don't rank very high as far as dancers are concerned in their choice of healthcare providers of healthcare advice. And often dancers prefer non-surgical treatments. The reasons are actually myriad. Sometimes it's just a matter of communication, where the way we convey anatomical derangement when they're injury to dancers, they might not understand. There's also these questions of relevance. When we tell them, you can't do this, can't do that, what does it mean in terms of which part of their dance can't they do, which movements they can't do? And then there's this question of course. Anecdotally, I remember when I was attached to the Harkness Dance Center clinic, which I thought was a haven for performing arts. And one of the things that stuck to me all this time is that the doctor will always answer, what's your job? What's your day job? And I thought it was a bit peculiar because they were dancers. And I realized that actually a lot of the professional dancers are actually supporting themselves doing a day job and then dancing at night. And this pattern is actually not peculiar to New York. It happens that even in the dance community in Singapore, a lot of dancers are engaged in daytime jobs, which might be in the dance field, but not actually dancing professionally in the daytime as well. So we have to keep that in mind. And this is a bit of local data. Again, the only difference being that TCM tends to be one of the places that dancers go to for management of their injuries, at least initially. How do we get around that? We really need to learn to communicate by understanding the lingo. the words that the dancers use. And the dancers, it would help, of course, if dancers understand what we are saying. When we sometimes at the end of the consultation, my dancers are surprised when after explaining to them that they have an ankle sprain, I thought it was explaining, and then they're somewhat surprised that, oh, my ligament is torn. And I said, oh yeah, forgotten to explain that a sprain the ligaments means there's a tear. We also need to understand the way they move, both anatomically and kinesthetically, because dancers learn their movements by experiencing sensations in their body. You need to understand the traditions of their practice. You need to understand the power dynamics, the interaction between the dancers and the artistic directors and the choreographers as well. I put up this slide as an example of when we do certain movements, we might understand it anatomically, but the dancers, but the kinesthetic cues that the dancers feel might not make sense. So for example, when I started doing ballet, I often have this feeling at the back of my knee, and the teacher will explain that, oh yes, that's correct. That's the hamstring lengthening when it's engaged. And the left side of my brain will say, the muscles are engaged, they should shorten, right? Or when I try to do a grand plie, and then the teacher will say, should you be lifting up when you're going down? And I think that sounds like Newton's third law, you know? And the practice is, there's a lot of these counterintuitive cues, but suffice it to say that there's a method to the madness, that when the dancers produce this kind of contradictory, the cues that are contradictory to what you might be trying to explain anatomically, or they actually engage the movements correctly. So we need to understand that in order to correct the technique. When I came back from Harkness, I actually was quite fortunate to have a bit of help from the NAC and the dancer from Frontier Danceland. We actually set up movement sessions to provide healthcare professionals with a kind of basic understanding of what dance movements are like. And lately, I kind of have been going into more depth, working with dance institution, trying to bridge the communication gap, teaching a bit of functional anatomy, injury prevention programs, and trying to communicate technical deficiencies to solve the recurrent problems, injuries in dancers. This is another caveat. This is a slide that I actually show dancers when I try to do functional anatomy to them. I don't actually teach functional anatomy to make them battle dancers, at least not in itself. I hope that by explaining the anatomical knowledge, by showing them and then showing them the landmarks where the muscles is, right, that they get equipped to understand their body better. So that when they encounter movements that they cannot do, at least they have a visual imagery of what their body parts are trying to do, and then connect it kinesthetically to what they feel when they're trying to dance. Once you get into the realm of actually trying to dance itself, there are so many considerations that there's no time to think about anatomy. So to any dancers who are listening, this is my caveat now. Communication to the teacher and the dancers is also very important. So this is another case study that we have a young dancer again who started on vocational training and start getting anterior hip pain with normal imaging, and then of course a bit of snapping at the hip. So anatomically, we think that is yes, it is iliopsoas snapping, and then she's getting a bit of pain at the AIS at the quadriceps origin. But to correct that problem, we actually have to look at the dance dynamics, and we realize that with the growth spurt, she has thoracolumbar fascia, and because of some compensatory movements, when she does the dégagé to the front, lifting the leg to the front, she starts having a bit of anterior pelvic tilt. That puts the quadriceps. Also, she overuses the quadriceps as compensation to lift the leg high, and the combination puts the quadriceps at a mechanical disadvantage, and she starts getting pain. So that to solve that problem, we have to get the participation of the dancer. We have to get the physiotherapists, and I have to explain the physiotherapists. This is what I need to correct in terms of flexibility and strength. And all this is useless unless I get the understanding of the teacher to look out for this problem when she returns to dance. So that we're trying to correct a lifetime of technical error. So it's a habit that needs to be changed. So it's actually quite complex. The other thing that I think we have to understand, or rather it took me a while to understand, is when my dancers asked me, is that a good pain or bad pain? And I was very confused in the beginning. I thought ouch, it means bad, you see. But really, when I started observing dancers and looking at them trying to, for example, do point work, I realized that in itself, the dance practice often you do encounter some pain even when you do it correctly, and that obviously changes the way they approach pain, their understanding of what is normal and what's abnormal pain, and we have to respect that. There are other reasons why dancers might view pain a bit differently, and that's from, as alluded to, there is a bit of social stigma in not being able to put up with the pain. Of course, there's this pressure to perform. Often dancers ignore pain in order to try to hold on to their part in a performance. In the interest of time, I'm just going to run very briefly through preventing injuries. And suffice it to say that there aren't that many markers of in screening that we can change in terms of at least in the current literature in terms of preventing injuries. At one point in time, we tried to look at fundamental movement patterns, and we realized that dancers are actually so well trained, especially the professional ones, that they score too well for it to be used as a screening. Maybe it is useful as a screening in a heterogeneous, less well-trained dance population. Personally, I find there is still value in using screening for professional dancers, because professional dancers or well-trained dancers are what I call masters of masking. They might have some deficit where they mask it so well, it is not obvious unless you do a detailed screening, pick out the asymmetry, pick out the weakness, and maybe you can try to intervene in terms of strengthening to match the aesthetics of the company. There is, of course, quite a lot of good evidence that shows that if you take even professional dancers and introduce a strengthening program, it reduces the injury rates. Okay. Last but not least, I think back to this idea about dance being artistic practice, there is a role for science, and I think I need to shout out to the people at Dance the Escape for introducing dance science in Singapore to dancers so that we can progress together into better dance health. So in summary, I hope in the last 25 minutes I've covered certain things that might be useful. My emphasis is that you need to understand the craft of dance. It is not just another sport. The aesthetic demands, the vocabulary spoken and movement is different. The traditions, practices are different. The psychosocial aspects are different. The way they approach pain. It is important to gain the trust of the dancers and their teachers as well. And of course, we have to invest more in terms of understanding the dance, in terms of communication, because ultimately we need cooperations in the dancers, the teachers, artistic director, to solve the dance injuries. So without further ado, that's the end of my talk.